Lisa Bonsall, Senior Clinical Editor for Lippincott Nursing Center. I'm here at the 2022 Nursing Education Innovation Summit, and I have the pleasure of speaking with Dr. Lorentz today. Dr. Lorentz is a full-time professor at AdventHealth University. Thank you so much for spending time with me today. Can you tell us about your role at AdventHealth University?
Sure. Well, I've been with AdventHealth, the organization, since 1996, and I've been with the university since 2005. I've held a variety of teaching roles. I've taught in the beginning part of the program in intro and foundations. I've also taught and teach now currently in the middle part of the program in an Adult Health 1 course. I also teach at the end of the program in a leadership and management course, along with transition to the nursing profession. Those are both senior seminar courses. So that's where I'm teaching now.
There was a big shift to using virtual simulation over the past 2 years in nursing education. Can you tell us how you managed at your institution, please?
The pandemic sure put a stress on all nurse educators over the last 2 years to come up with new ideas for trying to do clinical. We incorporated virtual clinicals using the vSim product. It's a great thing, and that was very helpful. We were lucky that we were able to get back into the hospital and lab in fall of 2020. So we only had one semester where we were really totally out of the hospital. The vSims, a lot of Zoom meetings, doing the best we can with what we had, which wasn't that much at the time, but that has been developed much further here in the last couple of years. So if it happens, when it happens again, we will be better prepared to have alternate forms of clinical.
Let's talk about virtual reality, or VR. How is that being used in simulation? And what's been the response from students?
I remember as a kid the idea of virtual reality being totally science fiction. And I really didn't have a high hope for it being anything really realistic for me to use. It wasn't really on my radar. It was like, that would be a good idea. But I had a chance encounter with someone from an institution that develops that kind of stuff, and we were able to develop the VR Pyxis, and it's been very well received. Other organizations, other companies have been developing virtual reality clinical, and I haven't seen them all. I've seen a couple, and for the most part, they're good. It's a beautiful medium to be able to have students encounter things that they might not encounter on a routine basis, and have them feel like they're there, involved in it, getting the affective feeling part of the clinical experience in addition to the cognitive and psychomotor part. It's out there a little bit. It's still gaining traction, but I can foresee in the next 5 years that it will blossom into something that's much more beneficial. Right now, the biggest problem is getting content, and it's time producing or time intensive and money intensive to develop the content that you need for VR, because it's a lot of computer programming that us as nurses, it's not our specialty. So we have to partner with other people who are developing that software to make sure that they develop it in a way that is useful and realistic and true to real life for nursing. Because if you just let the computer people do it, you get all kinds of weird things that sounded like a good idea, but it's not the reality of it. So we definitely need that partnership between us and the developers to be able to develop things that are useful and realistic.
Thank you so much for speaking with me today, Dr. Lorentz.